Anyway, we are going to move, as Tanya just mentioned, to our next speaker, who's actually a home player because this is her office. So thank you very much for extending these facilities and the support from the Microsoft team. But you're going to be talking, Elena Bonfiglioli, about empowering a new era of precision data, which sounds very exciting. I'm not going to go through your entire biography because it's very long and venerable, and people have the note, I think, in their programs. But a couple of things that just struck me, it's mentioned in your biography as a signature outcome of your work, and I think it's quite relevant to the HTO experience, which is with a core team of engineering and research. You were able to design and launch an AI partnership with Novartis in 2019. I'm allowed to say that because you're ex-Novartis, of course. As many, and AI for Leprosy initiative with the Novartis Foundation. And you also chaired the Health Cloud Council for Microsoft and partners from 2015 to 2019, and led an initiative on secondary use of health data and championed the work of data collaboratives, leading to the creation of the first global data collaborative in cardiovascular population health. So you have very real experience of how this works and how it should work and how it could work in the future. And therefore, we're really looking forward to hearing from you, Elena Bonfiglioli, from Microsoft.
Thank you very much, and good morning. It is a pleasure to host you all here today. And this is a day that many times I was hoping to see come to life, because actually many who has already been introduced, many had shared their vision several years ago for this day. And I was simply a sounding board and an enthusiastic supporter of these great ideas. So it's really an honor for Microsoft to see so many of you really being focused in what matters most, which is, can we really have the right structure for governance, but also the right tools in the hands of patients so that they can report their outcomes in a way that is standardized, in a way that is also very easy to do. Because frankly, as citizens, as parents, as patients, we know that we're very excited to report and do what it takes for a little bit. But if the tools that we have are cumbersome and difficult to use, we have so many messages and so many other things and emails and so on that frankly, it gets forgotten. And if it gets forgotten, the opportunity to save lives and have quality years, quality days, quality hours for patients is reduced. So I really see the opportunity with PROMS and PREMS as a vital step in the way in which we do healthcare in the future. I had the opportunity to be with Microsoft now almost 20 years, and I've been leading work both in health policy and in health tech, and now I have the pleasure to lead our healthcare business globally. And what I'm gonna discuss today is not a technology talk. I have no presumption to tell you exactly how AI contributes to improving precision health, but definitely I wanna share some of the stories, some of the implementation projects, and I will share those reflecting on the opportunity for PROMS and PREMS, okay? At the very, very heart of it all, I'm gonna move this chair, there. At the very heart of it all, there is a real belief, which is the advocate that is in me, which is convinced that data are out there and available. They need to be standardized better, for sure. And the tools need to be interoperable. But if the conditions are right, and if the protection of data and the management of data is done in the right way, data can save lives. And I think that is the one thing that brings us all together. They can save lives and improve the quality of the lives of people. And we are very far from there, but the potential is definitely there. And so when you think about, you know, an evolution from the 80s, for those that were working in those days on these matters, up to the 20s and beyond, there are a couple of things that have changed and that have really brought us with the opportunity that we have today and that the observatory has today. At the beginning, there was really the rush of digitizing the data. And it's interesting because the gold rush to the digitization of the medical records, which led to the electronic medical record, to the EMRs, was done with the tools that we had at the time. And that meant that we created systems of record. So what was in a pile of paper was protected in a box, in a digital box. And that system of record is great. But what you want to do with it is to have collaboration, to have engagement across the many stakeholders that touch on the life of a patient, including, if the patient is a child, the parent. And also on the system of record, you want to create insights. So we had to move from an era that is really, the electronic health records to, okay, what can we do with it? And at the same time, with the digitization came the opportunity to train, model, on the AI scale, machine learning model, and activate some insights, engagements, and action on the system of records. And that meant actually that you can start really having what I would call a trail that goes from the records into even the real world evidence, into the capabilities to create insights for practitioners, for patients, and for all the stakeholders, from research and discovery into the last mile of clinical delivery. So this, over time, the explosion of data and the ability to refine machine learning models that were more and more tuned into the workflow of clinicians or the workflow of researchers and pharma discovery of drugs, and the ability to bring those together is really what is going to bring us to more precision, both in the treatment, but also in the discovery of drugs. And I really believe that at the intersection of the two is an opportunity to have the best insights, which are with the patients, because you live with your disease every day. You know what it does to you. And so sharing that, I think, will be of tremendous, tremendous help. What I was describing here is really that fabric of data that creates a digital feedback loop, and where the patient cohorts, the individual patient, the population is really at the center. And up there are all the different signals, clinical notes, the self-reported outcomes, but also the Internet of Medical Things that come from a world of sensors, the omics, and so on. So you have a multimodality of data ingestion that need to be standardized, and you have also this multimodality from the individual to the cohort to the entire population. And that goes, if ingested in the right way, and we'll discuss that, it goes to feed the cycle of drug and therapy development into the last mile of clinical deployment and clinical delivery. And that, what's happening? Okay. Can you give me back control? Yes. And that is where some of the AI models come to bear. So I've tried to give the basics. In terms of when we think about AI and capabilities of AI, what do we really talk about? We talk about some of the functions that you do sometimes with your eyes, with your understanding, and with your ability to translate from me speaking English to your own language in your mind, some of those abilities that have been acquired by machines and automated. Now imagine that these capabilities are tuned to the language of healthcare. And let's give a couple of examples. You all know that when you're terribly frustrated, you try to book a flight, there is this chatbot that is trying to help you really understands what you really want to do, and it goes into a loop and so on. But imagine that that chatbot, which is conversational AI, in fact, is trained to a specific medical protocol and trained to understand the name of a specific condition, a drug, and so on. That capability has been able, during COVID, packaged in what was back then, you know, the Microsoft Health Bot, to triage the request of COVID patients and really help clinicians address the thousands when humanly you can do only a couple by the minute or by, you know, a few by the hour. So that augmenting capability of conversational AI really trained on a specific medical condition or on a specific task that needs to be done. Now, imagine that chatbot that could also be a nudging for the patient in the right way. If you haven't reported your outcome, for example, it could help you to do, hey, how are you doing? A little bit like a friend is doing, hey, have you gone running today? Or have you followed your diet? Or how is your headache today? So in the right way, it shouldn't be a negative nudging, but in the future, behavioral economics really tells us that that ability to be nudged in the right way is something that could help the experience. Another thing that we have seen, and I know it was mentioned in my bio, is when you have computer vision that is able to take an image and understand, you know, what is, for example, the organ that is being looked at, or if a lesion, it could be a lesion on the skin, is actually a dermatological, you know, atopic dermatitis, or if it is the beginning of leprosy. And it's the same capability that for a young person, when you take a selfie, can say, what type of acne do you have? It's the same capabilities, just trained in different ways. And that's why we worked with the Novartis Foundation to give in the hands of patients this method that would allow them to go beyond the stigma, and that they don't go to see the doctor because they are afraid that they're going to be put away from the community in Brazil or in India or in the Philippines and so on, you know, where we still have hundreds of thousands of new cases of leprosy, even if it should be now a forgotten disease. And the ability of computer vision to give a likelihood of, is this leprosy? And if so, you know, go to a doctor in this way. There is another element which a computer vision actually is doing for patients. We have now launched with Haleon, which is the consumer health part of GSK that's been spinned off. When you have the elderly population or visually impaired people, it's very hard to read the prescription, the drug prescription in the box. So we have launched a service which actually reads it for them. So it's this ability to go from written text to actually me narrating what is written there. And frankly, it's not only for visually impaired people, it's for simply, I cannot read it anymore, not even with my glasses when I try to really look at the dosage and so on. So there are many ways in which patients can be helped in the experience that they have of things. I wanted to bring, so these are a couple of things, but I want to bring a couple of examples. AI has been used in the same way in which AI is helpful to translate from English to Mandarin, has been used to translate from the language of the T cells to the antigens. It's the same type of machine learning problem. It's just very different input, very different output. And so for the first time, working with Adaptive Biotech, actually, we have done a map of the T cell receptors to the antigen. And that has been helpful for patient because it gives an opportunity from a draw of blood actually to create a new category of diagnostics, which finds the onset of, for example, Lyme disease or Crohn's very early on. And that, of course, increases the opportunity to medicate early on, but also to live better quality of life. And that is interesting because it opens up a full new opportunity when you think about, do I associate, for example, certain reported outcomes with some of the patients that were detected early on? So you really push, you bend the curve of diagnostics much earlier, not only with the capabilities of how our immune system responds, but with the capability of observations that you can put in the hands of patients. So imagine how that transforms actually the opportunity of clinical studies and cohort observation. Now, because you have been creating these observatories, it's a data trove, right? We need to make sure that it's well protected, because as much as it is helpful, it needs to be enhanced by privacy and by security. Technology, from a technological standpoint, allows really the opportunity to have trusted research environment, meaning zero trust, so assuming that everything that comes in is a threat, and making sure that the data are protected by a governance that the consortium decides. This is more and more the future of medicine. Why? Because if you study rare diseases, there's never going to be enough in one organization. If you want to have inclusive clinical trials, there is not going to be enough in a couple of pockets. You have to start spreading the amount of nodes, of data nodes that are being brought together. So what do? Do you bring them together in a centralized system, or do you actually create a governance of access to data, even sometimes not moving the data into a central repository? So all these modalities are possible. And the governance, as you are so busy doing the governance, that's the most important thing, because the governance then is translated into rules-based access. And rules-based access and categorization of sensitivity of data. And then from there, how do you protect the confidentiality, the sensitivity of the data, but also the IP of the algorithms that want to work on the data? And in this work, actually, Andrea is here in the room, and you will hear from him later. He's from Strategy, the last organization mentioned there. They've been working in making one of these trusted research environments a reality to save life of patients that are suffering of gastric cancer, to make sure that there is as early detection as possible. But why am I mentioning this? First of all, it's an amazing story of EU Data Collaborative for early diagnostics of gastric cancer and elimination of H. pylori, but also because this work started also from the vision of a clinician in Latvia, Dr. Marsis. And then you ask yourself, you can have clinical excellence, but if you do not have enough data sets to have a representation of the population that is big enough, I mean, Latvia is a small country. So how do you federate your clinical collaborations and the data that need to underpin the clinical collaboration across many countries? And that is where these tools of trusted research environment comes handy. And we have done the same with Novartis on cardiovascular, actually even collaborating with Apollo Hospital in India, who have done some of the best work in terms of algorithms for cardiovascular risk. And then I wanted to bring another perspective that comes from a government. The UK has launched the largest patient-based research program in the world. 5 million lives. So imagine if, as they do all of this work for population genomics, you can also empower these people to have in their hands reported outcomes. We, from Microsoft, we're honored to be selected actually as the trusted cloud provider for that work, with the same idea of a trusted research environment underpinning this work. So our future health is, I would say, the new generation, even going beyond from a data perspective from all of us, that was the largest till then, that was launched by Barack Obama when he was president. So really looking at the role of each of us as volunteers, as patients, as people that can report, can donate, of course, I would say, what is needed to understand the health of a certain cohort of population, but also could be armed with the input to report our experiences and our outcomes. And again, I want to stay on the power of patients. War on Cancer is a platform of oncology survivors, patients that went through cancer, different types. And out of the vision of a patient in Sweden, they started to create a platform in which they could tell their stories. They could tell their experience that was of value to others, from patients, for patients, through patients. And what we did actually, you remember the chat bot that I talked at the beginning? We put it right there in that platform so that they could also get suggestions sometimes, and chatting to say, what is the clinical trial that is best for me? But again, these type of platforms that are fully digital, is a digital front door, a digital experience, a digital query, a digital reporting. This is what we can also study as you look at experiences of patient organizations to be sure that whatever you build is future-proof. And the same thing has been done here during COVID, but there is one thing that triggers me, which is, look at who's operating a chatbot, a conversational AI, and a service to patient, Walgreens. And that is in the US, right? But more and more we see retailers also. If we think that nutrition, take Crohn's, for example, right? If you think about nutrition is a key part of the experience. So how do we make sure that we broaden our horizon? And as we think about patient-reported outcomes, who are the stakeholders in the healthcare of the future for a patient? And then how do we bring them in? And where technology can enable that management and multiplicity of stakeholders, that we want to make sure have the right holistic view for what a patient experience is and is going to be in the future. And I will use this as my last example, because we spoke a lot about patients, but a lot of the data of the patients, apart from how the patients live with their disease, a lot of the patient data is shared with the clinician. And oftentimes it's not recorded. So actually, I don't know if you're aware, but Microsoft acquired Nuance. Nuance is a voice-enabled dictation, I would say, voice-enabled workflow that clinicians and radiologists as well use at high, very, very pervasive. And that is fine. You're not putting, keyboards attention when you should focus on the patient, and you dictate. But you can go a step farther. You can have consent, ask the patient for consent, and you can have AI understanding your conversation. So Manny and I are having a chat, and I ask for consent. I look in the eyes. I'm not busy doing other things. We're simply having what it should be, a conversation focusing on the patient. AI in the background, structured from voice to text. So from voice to structured text. And as queryable information. So if she tells me, oh, I have fatigue and I have this and so on, all those things can be captured. And today they go somewhere and they're not queryable. So the ability to extend in a very natural conversational way what is queryable and what the patient's symptoms are, and associating it to further studies, and then to the progression of the disease as the patient is reporting and experiencing it, is an incredible opportunity going forward. And so that's what, you know, Microsoft and Nuance have done to redefine actually the opportunity in the patient-clinician conversation. This is not available in Europe yet, but in the US is becoming the next generation of standard practice. And so you could even imagine that all these capabilities will be powering proms and prams, as we will be gathering here again in 10 years and celebrating all that you have achieved. I'll stop here because I think that I used all my time. I hope that it inspired as you think about that, and just let us know where and how we can help, because it's a super valuable effort. And thank you for doing that on behalf of Microsoft and definitely me as a patient.